Good afternoon. We're in Madrid. New safety measures have been implemented, so there are less of us than there normally are. Let's see, the situation in Spain with regard to the coronavirus pandemic these last days, this last weekend has been similar to other weekends. In terms of new cases, there were 2,440 new cases. And if we take into account new cases that haven't been counted yet, we're at around 8,000 new cases in the last week. Every day there are between 7,000 and 8,000 new cases a day, at least in the last few weeks. We have about 240 cases per 100,000 inhabitants, and 45% of those people have no symptoms. So there have been 49 cases per 100,000 inhabitants. In the last 7 days, there has been a slight decline in the number of deaths with respect to last Friday. Most of these deaths happened in Madrid, 43 deaths in Madrid, but in other communities there are plenty of deaths, Aragon among others. As regards hospitalization, which is another interesting piece of data, we're seeing similar numbers to last week. It's true that the number of hospitalizations has slightly risen. There are over 7,000 people in ICUs who have coronavirus or who probably have the virus. And like every weekend, there are less people are admitted to hospital than on other days. So there have been over 800 people have been admitted to hospital in the last 24 hours. It is true that we are doing a lot of testing. At some point we will reach our limit, but for now, we're still going strong. In the last week, from the 28th to the 3rd of September, over 600,000 PCR tests. That's over 1,000 PCR tests per 100,000 inhabitants. In the last 24 hours, well, on the 4th, exactly, we did 94,000 tests, PCR tests, which is a considerable number. The number of positive cases is higher than it was in May or April. But it's clear that our policy regarding diagnosis is to carry out testing in areas that have been affected by the virus. So there is still an upward trend that we've seen in previous weeks. It's true that there has been a slight increase in the population over 70 years old, but it's normal for the numbers to go up and down. With regard to PCR testing, we've we're experiencing the same trend as previous weeks. The trend is an upward trend. We're having more positive cases when we do testing. There is a second evolution that is still rising marginally, but it's still going up. And that is in terms of new cases, detected new cases. And we are in a situation where our capacity to detect is higher than before, meaning that it's difficult to evaluate whether the situation is better than it was in May or April. I think it's better. I think that's it for now. Now I'll take some questions. Good afternoon. Now we're going to do a round of questions. We have less members of the press now to abide by the new rules that are in place now in Madrid. We will begin by Ms. Remacha from Dia.es. Good afternoon. I wanted to ask you something. Pedro Sanchez said something. He made a statement regarding the vaccine. He said that it would be ready by the end of the year. I know you're not a specialist in vaccines. You've said it many times. But what exactly did Sanchez mean by that? Does that mean that by the end of the year we will have a first doses, a first number of vaccinations, and which segment of the population will receive the vaccine? Well, it's true that I'm not a specialist in vaccinations, but I do know something about them, about vaccines. I worked with infectious diseases, so I know about vaccines. In the European Union, we are negotiating the purchase of vaccines, and we're negotiating with pharmaceutical companies, research companies that have an effective vaccine and that will be able to produce a sufficient number of vaccines. It's true that we will not immediately have access to enough vaccines for everyone because it's still being developed. But it's probable that by the end of the year, the number of vaccines will progressively increase. And since we can't give a vaccine to everyone, we have to decide which groups will get it first. Probably those who are vulnerable. And in Spain, we will have a policy similar to other countries of the EU. I don't know who the Minister of Health is. I think they've already mentioned some of the priority groups, essentially people who are vulnerable, the elderly, people who have underlying medical conditions, or people who work in the health sector or other essential workers. There are other groups who are vulnerable and who will quickly have access to the vaccine. But as soon as we get the vaccine, we will begin distributing it. Of course, we have to reach the right agreements, the right accords with the EU, but of course we will begin distributing the vaccine in Spain. And it's the groups that I've just mentioned will get the vaccine first. But I don't think there will be a big discrepancy in that regard. We will begin having access to vaccines by the end of the year. That doesn't mean that everyone will have access to it immediately. Now, right now, we don't think that we will have it by the end of December, by December. Now it is Andrea Sanchez's turn. Good afternoon. I wanted to ask about the return to school. Do you think that by returning to school there will be an increase in the number of new cases? Well, we have to evaluate that. The central institutions have to evaluate that, and the involved ministers also have to take a look at that, who will then coordinate the communities. The school and the healthcare system have to collaborate. Of course, there have to be nationwide measures. Everyone has to adapt to some extent. Right now, schools are reopening. Not all at the same time, but they slowly are. Now we're talking about a special school year. We've had to adapt to this pandemic. Our school systems had to adapt, and we've had to implement measures so that the children can learn in an adequate manner. So what can we expect? If you remember, I said in previous press conferences that we talked about people who have traveled around Spain to areas that have been very affected by this virus. So it's difficult to say what will happen, but we can expect some regions where there is a high rate of coronavirus. We can expect the people who go back to those areas where there weren't many cases of coronavirus. We think that there will be community transmission. There will be new cases. Now, if we're talking about students who spent their holidays where there are a lot of cases of the virus, they will probably transmit it to others. They will spread it to others. Obviously, these students, these children, they will probably take the virus into some of these classrooms, thus increasing the number of cases in certain areas. But if the rules, the safety measures implemented around schools in the country are taken seriously, well, they could mitigate the effects of those outbreaks, and we could control the outbreaks. We hope that this virus doesn't spread as quickly as it could. We hope that the safety measures that we've taken will be successful. We have a situation here, well, where our behavior has to change a little bit. We have to be very cautious, especially in areas where there is a high incidence, a large number of cases. That would be a good situation because if our safety measures work, that would limit the number of new cases. But we have to be careful. In areas where there aren't many cases and in areas where there are many cases of this virus. But it's true that we have to observe, that we have to watch the situation carefully. We're going to progressively open everything back up. So we have to be very vigilant. Everyone has to be very aware of what could happen. Let's hope that doesn't happen. But I think we will be able to detect any new outbreaks or what could happen in our schools. But the school centers here around Spain, there are around 28,000 schools. That's a big number. So we have to be careful. I mean, maybe at some point there will be an outbreak in one of these schools, one of these educational centers. I mean, we have to be aware of that. Okay, the next question. I wanted to ask you about something that is being debated in Germany. A political group by Christian Rosten is saying that most people are no longer contagious after 5 days. And after 7 days, they are no longer contagious. Is that being talked about in Spain? And with respect to the schools, the autonomous communities, 5 of them have returned to school. Do you think that the autonomous communities around the country are ready to reopen their schools? I'm referring to Madrid and Catalonia specifically. In Spain, if we look at how the contact around Spain is being managed, there is no need to order another lockdown. Right now, with the recommendations we're making, as soon as someone tests negative for the virus, they can start going back out again. Once symptoms have disappeared, people can start going back out. But if you've tested positive, if the PCR test was positive, you have to wait 14 days normally. Okay? And then you self-isolate for 14 days. And of course, we're talking about other alternatives are being discussed, of course. There are many positions that are being promoted. For example, there is one where fear reigns. So some people are proposing a quarantine of 14 days, a mandatory 14-day quarantine for those who test positive. But the probability of it being similar to SARS-1 is low. So we have to evaluate the scientific evidence. After 10 days, the viral charge in the body is low. And these people are no longer infectious. They cannot spread the virus. And then we also have to assume we have to take some sort of risk after 15 days, even though some people are still infectious. It's a low number. They could possibly spread the virus. But we have to take a risk at some point after 10 or 12 days. At the European level, there are more and more countries who have a similar policy regarding this issue. Of course, we're going to get rid of the 14-day mandatory quarantine. We have scientific data. We have to evaluate it, consider it, and then make a decision. But our goal is to control the epidemic. As regards schools, and your question, if are they ready to open, we've had many meetings with the school board. The autonomous communities have developed their own strategies with regard to the pandemic, and there's a bit of everything. Some people are not happy with our recommendations. Some people think that the risks are being exaggerated. Others don't. I think in general, our attitude toward the pandemic is the right one. Of course, there may be a school in particular, for whatever reason, that may have a much higher number than other schools. That could happen. That could happen. But I think in general, I know that we shouldn't do that, but in general, I think that the school board and the different schools around the country are ready for this pandemic. So what has happened in some schools, it will be difficult to test every child, and we don't know what that will mean for other students. But in the coming days, we will have more information regarding testing in schools. In general, we're ready, I think. We have to be careful that there can't be, if there is one school out of the 28,000 where there is a significant outbreak, we shouldn't generalize. I mean, we have to consider it separately. We have to evaluate the risks in general and act accordingly. Luis Marchar will ask a question. Good afternoon. I'd like to know your opinion on something that was said last Thursday by a pharmaceutical company in Madrid. They want to sell rapid tests. So do you think that pharmacists and chemists are qualified to interpret the results of the PCR and other tests and other coronavirus tests? And do you think that if now we can begin rapid testing, you think people are ready, and you think the internet will be a tool that can help us? With regard to rapid testing, we know that some of which are effective, and of course we have to carry out as much testing as we can, and then consider the results. With regard to the sale of these products, I don't know much, but it's true that the tracking system, the tracing system is in place, and more strategies and ideas are being put forth. I think that everyone will remember how painful and disastrous the results of our testing was. It in the beginning, we had very high expectations. Therefore, what we're doing is we have to trust these new tests that we have access to, and then we have to be able to interpret what the impact of a positive test will be in an area where there are few cases of the virus, and what the opposite will mean if our tests are not 100% reliable. or specific. That means that a negative result will change according to the number of cases in the region. Therefore, we cannot interpret the results of our tests correctly. So we don't know how much exposure or what impact that person's exposure will have on the test. So it's not easy, in my opinion. A drugstore, a pharmacy cannot correctly interpret the results of a test. But again, I'm not an expert in the field. I don't think that our government in general, with our framework, will let anyone interpret the results of a test. I don't know if the tests that are being sold on the internet are reliable. But of course, some tests are more sensitive than others. And then again, if a test is done in an area with a high number of cases, again, the results are subject to a different type of interpretation. A negative result does not guarantee an actual negative result. We may have the virus, and the contrary is also true. Sometimes we get back a positive result and the person doesn't have the virus. So again, it depends on the incidence of the region where the person is tested or where they spent time. So I can't say much more about it, about the matter, because I haven't read the letter that the pharmaceutical sector sent out to the government. But I know that drugstores around the world are working adequately. Another question from Asturias. Good afternoon. Okay. So if I understood correctly, you're not saying that going back to school is a big challenge. Which I find a bit paradoxical. It's a bit of a paradox. And with regard to the vaccine, do you think that areas that have been highly affected by the virus will have access to a vaccine before others? Okay, well, going back to school will be a challenge for everyone. For the schools, for those who are responsible, those who manage the schools, but it will mean different things in different communities. Of course, in those communities where there is a large number of cases, there may be new outbreaks. And it could mean that in areas with a high number of cases, with a large number of cases, the spread of the virus will increase drastically. Having said that, the measures that are being proposed, if we do things correctly and the schools act, they're prepared to face the pandemic and they understand the risks involved and the necessary measures are in place, and if the parents of the children are aware that they have to be involved in this process and that they have to inform their children about this virus. And of course, if the children themselves, I know sometimes they're very little, but I think children are a vehicle for the transmission of knowledge. They can pass it on to others, of course, through educational methods. So I think that if we all take responsibility for these measures, I think that our return to school, of course, it will have some kind of impact on the number of cases. It will be a limited impact. And of course, if there is a spike in the number of cases, we will have to work to get it under control. Now, our priority in this country is to protect the vulnerable. And the same is true of every autonomous community. If there is a group of vulnerable people who is protected, when there is the next spike, it would become meaningless. If there are others who are at risk, it would be too late. So what we have to do is protect the vulnerable first in general. And of course, we have to see if it's worthwhile to start distributing the vaccine to other groups. And of course, we have to do this in a progressive way. The distribution of the vaccine has to be progressive. Now it's Angel Diaz's turn. Given the relationship between the number of cases in certain communities and the return to school, does that mean that a school located in an area with a high number of cases is it faces a larger risk? Well, not necessarily, but that could happen. The risk in that school could be higher than in other communities. If 1 in 10 people in a community has the virus, if 1 in 10 children has the virus in certain communities, that would mean that 1 in 10 children in that community has the virus. So that means that in different classrooms around that community, we have to see how risky it is for children to go back to school. In some cases, that uncertainty may imply that we have to take some time and study the situation, but only if the number of cases is higher than in the community in general. If the proportion is similar, then there shouldn't be a problem. But of course, in some cases, there will be more risks. We may have to close down a school for some time. I mean, the object will not be to close down the entire school, maybe first one classroom, then another, and then wait and see. In other autonomous communities, we may have to close a classroom or a grade, and then after that, the entire school. But it would be wise to keep in-person lessons open. Okay, another question? Good afternoon. It seems that you're not completely discarding the idea of another lockdown. And I think in Madrid, the hospitalization rate is at 18%. I want to know what that means and what you think of it. In Madrid, as you know, last Friday, the new safety measures were implemented, and we can see it in this room. In this room, there are less than half of the number of people there were last Thursday. And these measures will have some type of impact on the number of new cases. Now, we have to evaluate whether it has improved the situation. and then we have to study it again, analyze it. There may be in some towns, villages, neighborhoods that may have to be put on lockdown again. I think that it's important that everything that is on the table be discussed to see what type of impact it will have on the pandemic, whether positive or negative, and how it will affect the evolution of the pandemic. I think that what we have to avoid is not really taking measures. We can't avoid lockdowns. What we have to avoid doing is taking measures without first analyzing their impact. So we're going to try to implement the right measures, implement them at the right time, and then from there, every possibility is on the table, meaning that the entire city of Madrid could be put on lockdown again, or certain neighborhoods. Everything is on the table. And we have been discussing this for many weeks. This is not new. Now, what reassures me about what you have just told me is that the people in Madrid understand that this option is on the table. And if we have to place Madrid on lockdown again, then that's what we'll do. But in the meantime, there are many steps that we can take to avoid another complete lockdown. Of course, it's being talked about, as you just mentioned it, but there are many other things that we can do. With regard to hospitals, the rate of hospitalization hasn't really changed. In general, 7% around the country. But it's true that, as we've been saying for some time now, according to the reports that we receive, certain regions have a much higher hospitalization rate than others, where in some cities the rate is as much as 12, 13%. These communities still have the hospitalization capacity to respond adequately. But again, the hospitalization rate in different hospitals around the country differs. So in some areas, the hospitalization rate is very high, and then in others it's lower, much lower. In some areas, we have these differences, even within the same autonomous community. Right now, we can respond adequately, with some trouble, but still adequately. So what we would have to modify the hospital's routine. We have to start thinking about actions, strategies that we can take to ease the burden of certain hospitals. And that's something that the autonomous communities in this country will have to do. But it is true that we have to have as many beds in the hospital available as possible. And if it were necessary, we can also begin transferring patients to other hospitals. But right now, we're still a ways away from that type of situation, that type of disastrous situation. I mean, some hospitals are feeling a bit of pressure, but they're still far from being saturated. If you don't have any more questions, thank you very much, and I'll see you next Thursday. I think so. I think we'll meet next Thursday.